Hello, good evening, everyone. I am Shanyeri Eze with Eze Family Health Center. Thank you for joining us tonight for our sister talk on breast cancer. I'm welcoming the audience to definitely stay engaged as we talk about this very important topic. I am joined here by my two amazing guests. We have Latoya Johnson. She is a physician assistant, breast cancer fighter, and founder of newly established platform, the Tata 365. Welcome.
Thank you. Thank you for having me, Chinyeri. I really appreciate it.
Certainly. And we're also joined tonight by a very special woman who's been very engaged in the community. This is Mrs. Ife Nwabu. She is the founder of African Women's Cancer Association, and she's also a breast cancer survivor. Welcome, Ife.
Thank you very much. I'm glad to be here.
Yes, I appreciate you both joining us. I apologize to the audience. We may have a slight delay, but hopefully you can follow along. Again, I encourage everyone who is watching, if you have questions or comments, feel free to share them. We're going to go ahead and get started. First of all, I want to really have our guests tonight discuss and share their personal stories in regards to their own personal battle with breast cancer, what to pursue their platforms and start their organizations. I wanted to start first with Ms. Wabuku. Could you share a little bit about the African Women's Cancer Awareness Association, how you got started, and also your personal battle with breast cancer?
Once again, thank you for having me. I started the African Women's Cancer Awareness Association some 17 years ago because at the time the women in my community did not speak about breast cancer. It was like a taboo, and the screening rate was very low. We were beginning to have deaths in the community, and the only time we spoke about it is if we went out to the funeral or the wake keeping. But it got personal when my mother visited from Africa. 3 months after her visit, she was diagnosed with stage two right breast cancer. Because she's been here only for 3 months, she didn't have insurance. I wasn't expecting her to be sick. I didn't have insurance for her either. But I did have a girlfriend at the time who was a trauma surgeon, the late Dr. Chinwe Otwe Agugua, who got her professional colleagues together and, treated my mother pro bono. So I was, really touched, but most importantly, I felt the need for some other women who would be going through the same journey and there's nobody coming to their aid. When you have breast cancer, that's not the time to dilly dally. When you have breast cancer, I believe that's not when your nationality, your ethnicity, your color, or your religion should come into play. And so breast cancer does not discriminate. And as far
Mhm.
as I know, is that once you're diagnosed, organizations like mine and many other organizations are there to work with you through the continuum of care so you can get the proper care that you need and hopefully work with you to make sure that there are no barriers to stop you from getting complete, thorough treatment so we can save more lives. So, in a nutshell, ironically, in 2016, I myself was diagnosed with breast cancer. Um, and this has to do with me, first and foremost, knowing that my mother had it. I was very conscious and always, every year made sure I did my mammogram. So my cancer was caught very early, DCIS, which is ductal carcinoma in situ, very early stage. Because I know I had a family history of breast cancer, I opted to have a double mastectomy, which is what I had. Um, Unfortunately, things don't work out the way you want it. My left breast got infected twice, and I ended up losing the left breast completely. But the good news is I'm alive. Hopefully, with what I've been through, I still stand to work and help women go through the journey of having breast cancer. It's not a very fancy one, but we're here to work with you. We're here to help you. And we're here to make sure that our women get screened early so that these cancers can be detected in good time. I must say that my late friend who had worked to help treat my mother with her cancer was also diagnosed with breast cancer 12 years after my mother's diagnosis. She battled her own cancer for 6 years and succumbed to it. So my mother died in 2007, and my best friend died in 2008. So I consider myself lucky. I'm here, I'm talking, and hopefully I have a lot to give to the community. So that's my story, and I hope you know we can help in any way I can to save another life.
Thank you so much, EP, for sharing that tragic, the things that you've experienced and what's happened to both your mom and your close friend. But I think it's how you've used those tragedies to then empower you to start an organization to save more lives. So God bless you for your efforts.
Thank you.
That was very touching. That was that was
Yeah.
very touching. Thank you.
And Latoya, we'd love to hear your story as well.
Well, good evening, everyone. My name is Latoya Bowes Johnson. I'm also a physician assistant, and I've been practicing in emergency medicine now for about the past 9 years. Um, a graduate of Howard University's PA program, and I was recently diagnosed. I was recently diagnosed July 26, 2021.
Oh.
Yeah, at 1:45 p.m. So I am a newly diagnosed cancer fighter, as I say. I am in cycle 4 of chemo. Um, so this is all new to me. I'm battling for my life now. I was diagnosed with stage 3C invasive ductal carcinoma. So that means that my cancer started in my milk ducts and spread to my lymph nodes, including my armpits and my left armpit, and also my supraclavicular lymph node. So it's in my neck as well, my neck region. Um, I am technically just a smidget away from my cancer being stage 4. Stage 4 cancer is incurable. Stage 4 cancer is when your cancer has spread outside of the breast into the lymph nodes and has now attacked another organ. Breast cancer likes to spread to the lungs, the liver, the brain, the bones. So I'm thankful that I'm not stage 4, but it also causes me a lot of anxiety just knowing that I am just one level away from my cancer, spreading outside of my organ, out of my breast into my organs. Um, when I found out that I had cancer, I was actually at work. I was actually on the front line working, still, with dealing with a Delta COVID variant surge. So I'm in full PPE, and I get an alert on my phone that my biopsy results were back. Um, and I did not. I looked at it because at this point. I felt the lump 2 weeks earlier. Had a virtual visit with my physician. She ordered a mammogram, and it never registered to me that when I looked at this pathology report that this would be cancer. When I looked at it, I thought it was an error. I'm like, I'm not reading this correctly. And let me log onto the laptop to, let me not freak out, because when I saw triple negative invasive ductal carcinoma, this is not me. This is not right. Like, I'm the provider. I'm the PA. I'm the ER practitioner. I take care of patients. This is not me. I'm not sick. This is not correct. So I verified it, and it was correct. And at that point, I could no longer take care of my patients. My ER attending physician, came to support me, and now we're in a phase where, thankfully, with chemo, I'm in neoadjuvant chemotherapy stage. My tumor is shrinking, and I'm grateful to God that my tumor is shrinking. I still have a long way to go because my disease is advanced. So I still have to require surgery and radiation. So I still have a long way to go, and I still have to finish chemo through January of next year. So it's been a lot, but I'm thankful that I'm here and I'm living. And because my disease was found at an advanced stage, and the fact that I have known that I wanted to be a healer since I was 4 years old, and that I wanted to take care of other people after going to a field trip at a hospital, I have now dedicated myself to trying to spread awareness to other women, especially women of color, because we are dying at higher rates of breast cancer. I just need to reach at least another woman so that she won't be in the predicament that I am right now, and that that you can get screened early and detect this early, and so that you can be caught in an early stage of breast cancer where you don't have to receive chemo and lose your hair and go through the side effects of chemotherapy that I am experiencing. But those are all small battles to fight. My most important battle is just being here to live for my family and to help other women not have to go through what I'm going through. So.
Thank you so much,
Toya, for sharing your story. Toya, I appreciate you and your strength. We've had conversations about, what you're experiencing, and, sharing your story, encouraging other women to get tested early. I recall you telling me how one of your friends did exactly that, and did discover that she had something as well.
Correct.
So God bless you for your efforts, and we're going to pray that the treatment continues to go well and for
Yes.
your full recovery.
Thank you. I have faith that I will beat this. I have faith in God
Okay.
that I will beat this, and I don't believe that God will give. The thing that I keep telling myself every single day is that God would not bless me with 3 young, beautiful little girls who are all under the age of 6 to leave them now at the age of 36. So that's what I keep telling myself. And that's what keeps me going every day, because my God is a merciful God. And I know that He has me here for a reason and a purpose.
Absolutely. Keep on the fight, my sister. Keep it up.
Amen.
Mhm.
You're very strong, both of you. Thank you both. So I wanted to, the whole premise of our discussion tonight is breast cancer and how it impacts the African American community in particular. And I wanted to share a few, what I would say are startling statistics about breast cancer amongst African American women. Um, so American women have a 31% breast cancer mortality rate, the highest of any other racial group in this country. Um, Breast cancer does affect more women than any other type of cancer and is the leading cause of death in women, as far as a cancer related death, excuse me. Among women younger than 45, breast cancer incidence is higher among African American women than in white women. Younger African American women in particular are more likely to present with the triple negative subtype of the disease. And it's a particular subtype that's more aggressive and associated with a higher mortality. Over the past 20 years, we've seen a rise in the incidence of breast cancer in African American women. There are disparities between mortality rates for white and Black women, and that has grown significantly. The mortality rate for Black women diagnosed with breast cancer is 42% higher than the comparable rate of white women. So clearly there is a problem. Clearly this is impacting our community in much bigger ways over, even over just the past 20 years. So Latoya, I wanted to hear your perspective on this. Why is breast cancer more prevalent among Black women compared to other races?
Well, as we all know, with African Americans, we have higher racial health disparities across the board. And part of that is, lack of accessibility to healthcare, higher poverty rates amongst African American women. We are not screened as our counterpart women in that group. We're not screened enough. Many of us also do not have that quality access to healthcare providers. So with those socioeconomic factors, those disparities alone plays a huge factor in the reason why, we're having a higher mortality rate of breast cancer. Because our counterparts are Caucasian women overall, they have a higher percentage of their population of being diagnosed with breast cancer, but we're dying at a higher rate of breast cancer because in many cases when we are diagnosed, it's advanced. It's advanced. And it's because of those socioeconomic factors that very much so play a huge part in, early detection, accessibility to quality health care, and so forth. So it's really a large subset of that is due to the socioeconomic health disparities amongst African American women.
Right. So I understand, oh, thank God for organizations like, for instance, the African Women's Cancer Awareness Association, because I understand, Ify, your organization has volunteers, patient navigators, to help women get screened, to even if, financial constraints or, lack of insurance is an issue. Um, that's something the organization does. And, you did mention earlier that there is this unfortunate of this cancer and the low rates of mammograms in particularly the African community. Is that something that, um, you in your organization, do you on in improving those rates of screening?
Yes, I must agree with Latoya about the various social economic factors that impede us from getting screening early, and why most of the time, by the time the African American women or African immigrant women present with their own cancer diagnosis, is already in a late stage. I want to say that over the years, we have worked very hard, and luckily, I would say that most of the healthcare facilities in the DMV area have partnered with us or opened doors for us, whereby we can bring women through our organization to get screened at a much earlier stage than it used to be. I would take Howard University Cancer Center Hospital, for example. From when we started the organization way back in 2005, they opened that door and asked us to bring in 10 women every month to get screened. I thought that was wonderful. And over the years, they kind of scaled it down to every other month. They call it the Mammo Day. So we still take women who ordinarily would not qualify for screening any other place without them having to pay out of pocket. So we still take them through Howard University Cancer Center for these women to be screened. Lately, we've also partnered with Breast Care for Washington, and they have a mammo van. So they would bring their mammo van once we can register at least 10 women. And so they'll bring their mammo van to our office site and screen the women. Once again, most of the women, they put them through a Project Wish program whereby they can pay for the insurance, but you have to meet certain criteria. That's where we have issues. Some of these women, either due to their immigration status or not being able to produce proof of residence, I mean, minor verification process will disqualify them. So that now would fall on our organization to actually pay cash for this individual to get screened. So I things have improved. However, there's still a lot more to be done for the Black community. so that we can reduce the mortality rate. Um, I can't say it enough. Early screening is the best way to fight breast cancer.
Mhm.
There's no guarantee that when you're diagnosed as stage 0 or stage 1, that things don't happen. However, at that early stage, there's always a 95 to almost 98% chances of survival.
Mhm.
And so we want to do the best we all can, encourage early screening, and find ways, find the funding to have it ready. If everything else, let's pay for these women to get that screening, because that's the gateway to even find out if you have breast cancer or not. We don't even want to find these cancers at later stage. So I'm thankful, Latoya, for your life. We'll keep you in prayers. And we know that the God we serve does not give us more than we can handle. So,
I I
yeah,
appreciate that. I
yeah.
appreciate that, and I really humbly appreciate that. And one thing that I wanted to add, as far as like why it's affecting African American women more, why is it, our mortality rate. A large part of this also is education, and it's not just it's education for the women in our community, just knowing that how to perform their breast exams, and that they should be checking themselves, and that they should be asking about their family health history, which a lot of Black families don't like to discuss family health history. Everything is a secret. We got to keep it a secret. You can't talk about Aunt May who has ovarian cancer. You can't say anything about that. And but also the education of that also plays into the providers, the healthcare professionals as well. There needs to be, I think there needs to be a retraining platform of healthcare providers. And I fall victim to that myself. Even though I'm not in primary care and that's not my specialty field, I had access to healthcare. I have health insurance. um, I didn't fall through that cracks of not having that access to care. I went to every single appointment. I got my annual, physicals, and but no, none of my providers ever screened me for an early mammogram based on my family health history or based on other risk factors, non-modifiable risk factors for myself. So there is also that education part for the community, but also for the healthcare provider community as well. African American women and Black women in overall, if you have those risk factors, you should not be screened for routine mammograms starting at the age of 40. We should definitely be, the American Cancer Society has already recommended that Black women should be screened at earlier ages, at least 30, 25 to 30.
Mhm.
If you have a first degree relative who died from breast cancer, let's say at the age of 45, your mammogram should already start 10 years earlier at 35. And not until I was recently
Right.
diagnosed, I did not know my full family health history on my paternal side, and found out that multiple women on my dad's side had breast and ovarian cancer. So we need to ask those questions, and we need to educate ourselves individually about our families in our communities, and also our healthcare providers as well. We don't need to look at the person's age. We need to look at those other non-modifiable and modifiable risk factors in their health history and order those mammograms for those patients.
Yeah, can I add into what Latoya just said? I think it's very important, and in the Black community,
Mhm.
that we must
Mhm.
learn to begin to pass down family health history. Because if you know your family health history, that hopefully will change the way you do things, especially if there have been history of aunties or mothers or grandmas who have had cancer, actually any type of cancer, especially breast and ovarian. Then the new offspring should start their screening at a much younger age than the one that is already down for us to start screening at age 40. If I know what I knew, then I should be able to also teach my children and let my daughters in particular know that because their grandmother had breast cancer, died from breast cancer, I have breast cancer, they should start their screening much earlier, long before they are 40. As women, we also need to teach our daughters the breast health. They need, once our daughters begin to develop breast, I think it's left for us to find the best way at that level to teach them all about their breast, what is normal and what should not be normal, so that it's easier for them to be the ones to detect when something is abnormal long before we put it on the provider to find out. So we now have to change how we teach our girls so that our girls know very, very early what is normal for them and what a normal breast should feel like, look like, and the likes.
Absolutely.
Absolutely. And it's so important. Yes, it's so important that we educate, inform, let people know, let women know the risk factors that may exist in regards to developing breast cancer. So, increased age, family history, obesity, history of hormone therapy, um, and inherited genetic variations. So, that will include the BRCA1 and BRCA2. So, no understanding the risk factors that are in place is important. I know that you mentioned a few things in regards to knowing your family history. That's thing that's very important. With your mother having had breast cancer, and then Latoya, you finding out that you had multiple family members on your father's side breast cancer. So it's one of those things. Had you known then, right, what you know now, you would have done the screening much earlier.
Much earlier.
So let's talk about these of breast cancer. Yeah. So the signs and symptoms of breast cancer. For either of you to answer, what are some of the things to look out for?
Well, you definitely need to be performing monthly self breast exams. And the most common symptom they can find is finding a lump. So, lumps, nipple discharge, whether it's milky, yellow, clear, bloody discharge, skin changes like skin dimpling of your breast, um, swelling in your armpits or enlarged lymph nodes in your armpits is also a sign. Breast cancer does not always resemble. It can be painless or it can be painful. So those are some of the symptoms that you definitely need to be on the lookout for it, because that's how I discovered my breast cancer, because I felt the lump. And I did not initially think, I at that time, it didn't register to me that this was breast cancer. Like, I was still, because it didn't feel that firm. It wasn't that hard. It felt, as Black women, or as women in general, our breast tissue tends to be more dense. So it still didn't feel hard like a pebble or a rock. And it did never register to me at that time that that was cancer. I just thought that, this is probably an enlarged milk duct, because I had recently stopped breastfeeding a few months prior. So those are definitely some of the symptoms that you should be on the lookout for.
Also, I would like to add
Right.
the the size of your breast. Sometimes, like one of my daughters, one of her breasts is much larger than the other one.
Mhm.
And so for her, that is normal. However, most women, their breasts are almost symmetrical. So, if for any reason from out of the blues, one of the breasts begin to get more enlarged,
Mhm.
more than the other one, which you know it's not normal for you, that should ring a bell that something is going on, even if it's not breast cancer, because that means there's a change in the size of your breast. So you need to go check that out. The other one is sometimes the coloring.
Mhm.
Um, as Black women, I mean, the darker you are, you may not necessarily or easily notice a change in coloration. However, you should know your breast well enough, when you're taking a shower or when you take off your clothes, to take just a second to look at your breast. This is something we don't do. We run into the shower, run out, put the dress on, and that's it. So we need to begin to take time to look at those breasts, because that's how you can notice there's discoloration either in one of your breasts, which wasn't the normal color if you've always taken a look at that breast. Also, sometimes the breasts begin to like crackling. The look of it, you would know it's more like a rugged orange. You can
Mhm.
scale it off. Um, so those type of things on your breast should, ring a bell that something is not really right. And then worst of all, if for any reason we are not conscious or very careful, and it goes to a point where you're feeling pain, any pain should alarm you that something is definitely wrong. So by the time you begin to feel a lump, a pain, a discharge in your breast, that's the time you really run to your healthcare provider to help you find out what's going on with your breast. So those are, the basic ones that the eye can see. So let's make sure we look at our breast and we make sure we know what our breasts look like. I was in a workshop one time, and the speaker said something that stuck with me. She said, "Every woman must know their breast. You know it to the point that if there's a display of breast anywhere and you're asked to pick up which one is your breast, you should be able from the lineup say, D, this is my breast, and there's no doubt about it."
All right.
I thought it was funny,
Mhm.
but by the time you know your breast that well, then my sister, you are you are in a good place. So we encourage women to take time to, know your breast. Know it in every way, the shape, the color, the size, everything about that breast. The nipple. The other thing that we should also look out for is sometimes the nipple dimpling.
Mhm.
Yeah, so women have different style or sizes of the nipple or shape of the nipple. So if you know yours and all of a sudden your nipple is beginning to get inverted, dimple, or do anything more than the usual, that also is a sign that something is going on with your breast. So it's a whole lot of little things that we need to be aware of. These are the early telltale signs of something going wrong in the breast.
So, can you explain how to properly perform a self breast exam?
Sure. So every woman should at least be doing monthly breast self exams. As soon as you, like Miss Effie said, as soon as you start to develop breast, our mothers need to be educating our daughters on how to do their own breast self exams, because breast cancer does not discriminate as far as age or color, and it can happen at a very early age. So, but in most cases, you can start off with, I'm not sure if you can see this or not, but I think in most cases, in most cases, you can start off, with, it's easier to do it in the shower because it provides like more of a slippery surface, but using the pad of your finger, and there's like three different methods, whatever method that you're comfortable with choosing. My go-to is just kind of starting with the outer quadrant of the breast and working your way in a circular motion, going all the way around to the areola. I would start actually in the abdomen, so the abdomen, armpit. And there, you're feeling any swelling or what we call lymphadenopathy, because that's enlargement of the lymph nodes. So you really want to be starting in that area, from the neck, starting here and working your way down, because you can have lymph node enlargement here. So starting here, working your way down into the armpits, filling with the pad of your finger, and then working in the outward motion with the opposite. So you're going to use your opposite hand. So if you palpating your left breast, you're going to use your right hand and working in an outward motion, going all the way around as she is doing here, and then going all the way to the areola to the nipple. You want to squeeze the nipple to see if there's any discharge. You also want to be looking at your nipple too to see if there is any dimpling or inverted nipples as well. But here are some other methods here as well, like method one, where you're starting near the underarm, and then method two, like when you're using wedges of the breast, moving your fingers toward the nipple and back to the edge, covering the whole breast area. You want to make sure you're getting all the breast tissue. And then there's another method, method three, where you're going in the circular motion outside in the outer edge, kind of like in a concentric circle. But ultimately, you want to make sure you're reaching all the breast tissue, whichever method you like to choose. And there's many resources online, in videos. There's a lot of videos online as well, how to perform your own breast exam. But I just wanted to reiterate, make sure that, if for me, going in the shower, starting the neck, palpating my neck back here, armpits, opposite arms, and then going in that outward circular motion, to palpate all of the breast tissue, and definitely squeezing the nipple for checking for any discharge. And you want to make sure you're getting, depending on the larger size of your breast, making sure you need to lift your breast up, making sure you're getting underneath the full breast tissue, to make sure you're not missing any areas. Breast cancer usually does feel more hard, like, like a pebble. Um, Dr. Michelle Craig from Howard University used to always instruct her patients when I was a PA student. I used to get a kick out of it, but she would always tell her patients, throw up your middle finger like you're throwing up your bird middle finger. She would say, touch the edge of your nose. And she's like, this is kind of like what, your breast tissue needs to feel like in this area here, like kind of lumpy. Some breast tissue is going to feel different. But once you go up and you keep going up, now that's bone. You feel that, then you know that this is definitely not right. This is more so could be cancerous. And she is also a breast cancer survivor, and she is a primary care physician in Washington, D.C. So her method worked, and she was able to find her own breast cancer. So I kind of always kind of employed that same tactic whenever I did have any patients in the ER. It's not common for me to do that because I'm not primary care, but that was something that stuck with me from Dr. Michelle Craig. So I would always kind of tell patients the same method.
Yeah, can I add one thing to what you just said, Miss Latoya?
Sure.
I know of a very large breast cancer foundation that does not endorse breast self examination.
Mm-hmm.
My thing as a Black woman and having worked in the Black community, most of us find our own breast cancer.
That's true.
So please learn how to do your self breast examination.
That is
For
true.
us, it saves life. Outside of this environment, in Africa, I do a lot of medical mission. 98% of them find their own breast cancers.
Mm-hmm.
So if you learn how to do your self breast examination, do it monthly, do it religiously,
Mm-hmm.
hopefully you would have been good at what you do to be able to find your own cancer long before it gets to that stage where it's a point of no return.
Absolutely. Absolutely. You're your best self advocate.
Advocate.
You're your best self advocate, no matter what the healthcare provider, regardless of their credentials, and
Yes.
your best self advocate. You have to know how to do your own self examinations. And I can't tell you, I spoke to a pharmacist a couple days ago who's also a breast cancer warrior. She's in remission for 4.5 years. And she found her own breast cancer as well by feeling a lump. And she said that her physician told her that the mammogram showed no signs of cancer. And she was like, no, wait a minute. I still feel a lump here. Like, I want a biopsy done. And she advocated for herself because she is a pharmacist. So she had that medical background. And when they did the biopsy, it came back as stage 2, HER2 cancer. So, nothing is mammograms and ultrasounds, they're not 100%. But if the point is that if you feel a lump, I implore every woman to make sure that you still push for, a biopsy, because a biopsy is going to be definitive.
Right.
That's going to be definitive, because that is going to take that tissue from that lump and make sure that it's not a cancer. Because, like I said, in my situation, I was misdiagnosed initially. I was misdiagnosed. I felt my lump, and by the time that you feel, in most cases, when a woman feels her own lump, at that point, it's almost always 1 to 2 centimeters when you feel your lump yourself. So when I felt my lump, I was misdiagnosed as having a milk cyst, a galactocele, because I had been recently breastfeeding, and still it didn't register to me that, okay, this is cancer. I'm thinking that this is just a milk cyst because I can squeeze my nipple and I still have milk coming out. I still have milk. So I just really, really thought that it was a milk cyst when breastfeeding. And that breastfeeding is supposed to protect me. Only 1 in 4 women who breastfeed develop breast cancer. So I really was naive with having this medical background, but also just recently breastfeeding, that this is just a milk cyst. And I was misdiagnosed as having the galactoseel. And it wasn't until another radiologist called me and was like, no, we should get a biopsy. And that's how it was diagnosed in my situation.
So both of you said something very poignant, and that is being your own advocate. Even
Best.
when, a provider may not be so inclined, yes, a provider may not be so inclined to order tests, to order a mammogram, based on your age or what have you, insisting that further evaluation is done. It is so important for us. And I know, patients may often feel intimidated, or they feel like the doctor knows best. And even though providers are very well educated, they can make errors as well, errors of omission as well, in which they may not be as aggressive in pursuing a lump that is found, or even dismissing it as other. I know with my patients, all my female patients, as young as 25, especially if they have a family history of breast cancer, I instruct them on self breast exams, also at what point they should be starting to get mammograms, because we can't always go by the general guidelines.
Right.
You have to know your body. Jake EC said, knowing your body, that is important.
Mm-hmm.
So we have a scenario, for instance, a young woman finds a lump in her breast. What is the next step? Mammogram, biopsy? How does one go about getting further intervention or evaluation if a woman does find something?
So generally, the next step would be to talk to her physician, because the next step would be to get imaging. So the next step would be mammogram and/or ultrasound. Once you do feel the lump, mammograms. I know for myself, I was a little scared at first, but we have different advanced technologies now, and it's not painful. It's just something that just kind of feels uncomfortable because the machine is squeezing your breast tissue, but it's a painless procedure. But the next step will be imaging, and if they find something on the mammogram, because a mammogram can pick up, it can pick up cancer as small as like a piece of grain, like a small piece of, rice grain. So it's a very reliable test. And if they see something, you feel a lump, and then you see something abnormal on the mammogram and or a sonogram, the next step will be to have the biopsy done to determine if this is cancerous or if it's benign or non-cancerous.
So it's also good to know that all lumps are not cancerous.
Right.
So don't start freaking out if you feel something. Oh my Lord, it's cancer. All lumps are not cancerous. And
Mhm.
like Latoya have rightly told us, we must insist on having a biopsy, at least to be more definitive whether it's cancer or not.
Mhm.
So we have that in mind. Also, I feel more for the younger uh, girls or women, because unfortunately, because of their age, if maybe at 26, 27, 22, you find a lump, nobody's thinking cancer at that time.
Mhm.
And
Mhm.
so, more often than not, if you the individual is not insistent on saying, I need to make sure what is this. Sometimes, just because of your age, or it can be cancer, you're too young. But we do know that people of African descent have cancer at a much younger age than our Caucasian
Mhm.
counterparts. So I would advise that even at that young age, in your 20s, if you find something that is unusual or abnormal, you know, make sure you try to work with your provider so that they can do some diagnostic testing to find out, or imaging to find out exactly what it is.
Mhm. I agree. And interestingly, I'll just share this with you all. I had an ultrasound of my left breast, the cancer where I have breast cancer now. I had an ultrasound of my breast 3 years ago, because I thought I felt the lump, and my provider at that time, my physician, she just ordered an ultrasound, and it came back as dense breast tissue, nothing abnormal. But in retrospect, um, I should have received a mammogram at that time as well. It should have been a mammogram and an ultrasound. Um, and had I known my family health history, I would have definitely pushed to have the mammogram at that time at age 33, but still wasn't thinking of anything of it. And after speaking with my oncologist, because that was weighing on my mind, I'm like, and my physician, she actually is no longer with, that practice. And she reached out to me when she found out that I was diagnosed with breast cancer, and we talked about it. And, what I would say to that is was blaming myself, or just like, this cancer was there. Like, I felt something 3 years ago, then maybe this was it. But my oncologist was like, there's no way that, you would have had at this stage of your breast cancer now, that you would have had that 3 years ago and you would still be living. My breast cancer, he estimated it, and no one knows for sure, but he estimated it about, it developed maybe a year ago. But the thing that um, I want women who are pregnant and women who are breastfeeding or recently are in that postpartum phase, is that this is how the cancer can really sneak into you. Because, mind you, I've had 3 pregnancies back to back. I have a 6-year-old, a 4-year-old, and a 1-year-old, and I've breastfed every last one of them for at least a year. So I'm doing the things that I thought that could, protect me, and was also best for my baby. But at the same time, this last pregnancy, that's how my breast cancer was able to hide. Because when you are breastfeeding, your breasts are more lumpy. You still have milk. So I never, if I felt something, I'm just thinking it's because I still have breast engorgement. I still have milk. I can still feed my baby. It never occurred to me that this could be cancer. So I implore women, if you are pregnant, breastfeeding, and you feel something, you still need to push your doctor to order, a mammogram or ultrasound. I have a friend who is a childhood friend who's the same age as myself at 36 years old, and she was diagnosed with breast cancer at 38 weeks of pregnancy. And she had been telling her doctor, said, for like a few months, that she felt pain in her breast, and he was like, "Oh no, it's okay. It's just your milk coming in. You're pregnant." And she pushed for it only because her mother had recently died from breast cancer, and because she pushed for it, and she was diagnosed at 38 weeks of pregnancy.
Mm.
Yeah.
All right.
So
Wow.
yeah.
Important, and we emphasizing the importance of being familiar with your body, knowing when something's not right, and getting it checked out, being your own advocate for your health. Not emphasize that enough. especially we as Black women, as young Black women, if you find something or you feel something that is abnormal, and you go to your provider and they just find a provider that get the evaluation that you need. It's nothing to play around with. It's nothing to delay. Trust your intuition when something isn't right. Now, with breast cancer, we talked earlier about the different staging, uh, uh, the different types and the subtypes. I think we mentioned earlier about that is more commonly found as a more aggressive form in younger African American women. So now I want to get into a little bit about treatment of breast cancer and what determines what type of treatment um, will be used for to get rid of the cancer. Does it depend on a woman's age, how advanced they are? What are the treatment? And I understand both of you have undergone treatment. Kind of explain to the audience why is there different modes of treatment.
Sure. So yes, you're correct. It does depend on, and I know Miss Effie had a different course of treatment than myself, um, but it does depend on your staging. So that's why, as Miss Effie said, as well, early detection is key because the earlier you catch it, the better your survival rate and less invasive uh, treatment modalities. So, for example, there's stages 0 through 4 of breast cancer, and in the stage 0, I don't know if you can see that there's different stages, and in stage 0, you can see here that this is where you have these cells as DCIS or ductal carcinoma in situ. This is at stage 0, and this one carries 100% survival rate. In most cases with this one, you can opt for surgery, whether it's a mastectomy or a partial mastectomy, depending on your preferences. After speaking with your oncology and surgery team, this one does not require chemo in most cases. This is just kind of like surgery, and uh, depending on if your cancer is fueled by estrogen or progesterone or HER2, then they may add something like tamoxifen if you are, estrogen receptor positive and you take that for 5 to 10 years. It just really depends on, after discussion that with your oncologist. And then, so moving on into like stage 1, now the cancer is in the breast tissue. It's usually like less than 1 inch in size, but it really hasn't spread out into those lymph nodes. And it's still an early stage as well. And then even with this one, you can still opt for surgery, whether mastectomy or partial mastectomy. Um, and in most cases, you don't require radiation. And the differences between a complete mastectomy and a partial mastectomy is just having a complete breast removed, or if you're going to have just a piece where you're going to have a partial mastectomy or lumpectomy, as they say. I know a lot of women opt for just having a double mastectomy, especially if you have those gene mutations, those BRCA1 or BRCA2. Most women opt for just having a double mastectomy just so they won't have that fear of recurrence and reducing your recurrence as well. As you all know, that's why, there was this big thing surrounding when Angelina Jolie had an elective double mastectomy because she tested positive for those gene mutations. And that brought a lot of attention to the genetic markers that increase your risk for breast cancer. Um, and then you have like stage 3, which I have, and I'm sorry, I skipped stage two. Then you have in stage two. At this point, that's it's in your breast tissue, but it's also at least 2 inches in size, and it's already spread into those armpit lymph nodes. So that's why it's important to check those armpits. And in that case, you do have to have surgery. Chemo is recommended for some, but not all. And you can also opt for when you have the surgery for if you're going to do reconstruction. Some people opt for having reconstruction with fat transfers from like your abdomen, or some people opt for having implants and tissue expanders or whatnot. It just really depends on personal preferences, your body type, and what the breast and or plastic surgeons recommend, depending on those factors. So you do have a say in what type of surgery that you opt for in that instance. And then with stage three, this is where, this is definitely where the chemo is involved, as in myself, with me having stage three. You can have neoadjuvant chemo, which is chemo starting before surgery, which I have. I receive dual combination of chemo right now, and then I'll switch to a different one for the rest of my cycles. But this definitely requires chemo because it's in the breast tissue, but it's also spread into multiple lymph nodes, into the neck region, and into the armpits. So now the chemo has been initiated because it needs to shrink the tumor. So in my instance, my tumor was pretty large actually. My tumor was 5.2 centimeters I was diagnosed. Um, so it was a pretty large tumor. And the chemo has now shrunk the tumor where it's no longer palpable on exam. So I'm grateful to God for that, because my oncologist couldn't feel it 2 weeks ago, and I felt this tumor starting to shrink after the second cycle. So I'm very grateful, because sometimes chemo doesn't work and you may have to change to a different regimen. So that you have to shrink the tumor, then it requires surgery and radiation. And with if I'm opting for something like breast reconstruction, which I do want to get a double mastectomy, breast reconstruction will have to be delayed until after radiation, because breast reconstruction and radiation are kind of like arch enemies. It can really do some damage there. And then, of course, you have stage 4, which is, your metastatic breast cancer. And in that instance, it's more so, in this instance, your cancer is incurable. Once it gets to stage 4, it's incurable. Is now your treatment is all based on just systemic treatment, symptomatic improvement, because now your cancer has spread outside of your breast tissue and it has hit another organ, whether it be your liver, your lungs, sometimes your brain, more commonly your bones. It forms tumors in your bones. So now it requires multifactorial treatment, immunotherapy. There's different immunotherapy that they try for that, and just doing the chemo to try to shrink the tumors as much as it can, but it's not curable at this point. And that has the lowest survival rate, metastatic
breast cancer.
breast disease. Yeah.
Thank you for very extensive classification of the staging. I know that currently research have shown that us Black women, there's a larger percentage of us living with metastatic breast cancer. So once again, we all have to do what we can, hopefully not to be getting to that stage 4.
Mhm.
I know all diagnosis or all individuals are not the same. I count myself as the one of the lucky ones because my cancer was found very early at the stage 0, at almost going to stage 1, and so I honestly am very thankful and grateful that God didn't give me more than I can handle. I did not go through chemo, neither did I go through radiation. However, like I said, because of my family history, I opted for the double mastectomy just to have a peace of mind.
Mm-hmm.
This cancer is not going to be found in the other breast. Things go wrong, and my plastic surgery reconstruction didn't really work out for me. I mentioned earlier I had two very massive infections, and the second infection almost actually took my life. I was sepsis. So I ended up losing the left breast. But, when we look at it, I still will continue to preach for early detection because that's where you have, Latoya said, 100% survival rate. So that's where we want to catch the cancers. But again, there's not much we can do. Sometimes things happen, and we just have to go with what we can do.
Absolutely.
Battery is.
Absolutely. Thank was This was very informative. I'm so grateful for you ladies sharing your stories, informing our audience of breast cancer, especially in our community, the importance of prevention, being your own advocate, as well as knowing the risk factors, knowing your family history, knowing when to seek medical intervention, and also, understanding if God the cancer is found, what are the treatment modalities that are available.
Mm-hmm.
I did want, just to, in conclusion of today's discussion, I wanted to hear, if you have any last, thoughts, recommendations, or comments in regards to your own personal experience with breast cancer, as well as any individuals that you've come in contact with or have been impacted by breast cancer. So, if any of you have any last thoughts, and then I'd also like for you to share with the audience how they can get in contact with you. If there's a platform, website, social media, in order to, stay with all the activities that you are doing on your particular platforms or organizations. So, Ify, I would like for you to start. Any last thought, information you'd like to share?
Yeah, I would like to state like that as a black woman that we need to do more for ourselves. Be your own best advocate, and most importantly, when you're diagnosed, my organization, for example, have trained patient navigators. And what these individuals do is that we pair them with women who need help while they are getting their treatment. So they work with you to make sure that there are no barriers at all impeding you from getting proper treatment, or allowing you not to be able to go get your chemo or go pick up your medication or childcare. So that's one. We also have a breast cancer support group in my organization. And what that does, it's like a safe haven where women like Latoya, myself, people who are newly diagnosed, people who have already gone through it, we come together and we form a support base for each other. Because these things, the journey is not easy. Take it from us who've been there. It's not easy. So we form that support base. Um, it's like, we're friends. We're there to help you out. We have counselors who are ready to work with newly diagnosed patients, even survivors, people like me, 4 years survivor. You still have your down times. Mentally, you still need people who can help you work through what your emotions are. Even though you've survived, there are side effects. Fatigue, for example, is one of my side effects. So I get extremely exhausted from time to time. So we get experts to help us through all this, understand where we are. But most especially is that organization like mine, we do fundraising all year round. But most especially once a year, we have a fundraising program we call the Ladies First Breakfast. So with Ladies First for a change, ladies, we want you to make yourself first. We are always waiting and taking care of your spouse, significant other, children, mother, father, family, except you. So we want you to start getting very, very conscious that you matter. You matter to yourself. And if you're healthy and you are well and you are happy, of course, everything around you will benefit from it. So we want you to start putting yourself first. Take care of your health. So you can reach us at 301 565 0420. I'll share it in a little while. And our office is 8955 Edmondson Road, Greenbelt, Maryland, Suite D. I would also like to announce to the listening audience on the 30th of this month, we have a telethon, also fundraising for breast cancer early screening. So we are shooting to be able to fundraise, bring in $50,000. It sits there. When women are going through breast cancer, sometimes they lose their jobs. They can't pay their rent. So I know that within this year, we have been able to help women. I think 4 of them pay for their rent. Landlords, they understand, but they still want their rent. Utilities. So these are not illness, your utility or your rent, but you need a roof over you when you're sick. So these are things that the insurance is not going to pay for you. You have health insurance, but it's not going to pay your rent. So when we fundraise, we want to make sure that we're giving women a break when they have breast cancer. So we will share more information, but I'm here. I'm happy to answer questions, and we'll continue to pray for women who are going through breast cancer at this point. You're frozen.
Oh, we can't hear you.
Oh no.
Is she there?
Yeah, she's saying something. We just can't hear her.
Oh, okay. Um, well, I think I
I
can't hear her.
apologize. I'm
Oh,
back.
Okay.
Okay. I apologize, ladies. A little bit of a delay on the video feed here. But what I was stating is that if for those who are interested in finding out more about your organization, EFI, I believe they can go to the website of the African Women's Cancer Awareness Association, and that's
Right.
at www.awcaa.org.
That is correct.
All right. Latoya, any last thoughts or words of advice, words of inspiration, and also tell us more about your platform as well.
Um, in a nutshell, as discussed earlier, I would just make sure that you're being your own self advocate, that you're performing your own breast exams. Don't let anyone tell you any different. And be diligent, especially if you're pregnant or breastfeeding, that if you still feel a lump or you feel something abnormal, don't let your doctor just tell you, oh, it's just, your milk coming in or it's just your milk residual. Just get checked out to just make sure, because that is my mistake that I made myself. As being a healthcare provider, as you know, we can make mistakes. I'm a human being just like anyone else. So don't think it's just a milk cyst. Make sure that you get it checked out and that you get an ultrasound and a mammogram. And if you still feel that lump, make sure you get a biopsy. Do not let anyone tell you that. Do not let anyone tell you that you're too young to get a mammogram. Triple negative breast cancer that I have is more, it's seen at a higher prevalence of African American women diagnosed under the age of 45. So you're never too young for a mammogram. If you have breast, you can get a mammogram. You should get a mammogram if you feel that you should have it based on those higher risk factors. Breast cancer does not just start, if you're in your 50s. There's no age discrimination to this.
Yeah.
I'm 36, so I'm a living example of it, and I hope to live for many years to come.
Amen.
Amen. So that's what I would say in a
Yes.
nutshell. And also, because I am a healthcare provider, I just want to continue to spread awareness to try to help women specifically and just share my story, because my story can reach someone else. Or my stories that I've received from other women, who've been diagnosed during pregnancy or breastfeeding or still felt the lump, but the ultrasound is saying negative and she pushed for the biopsy and it was determined that it was cancer. Those stories, as a community, makes us stronger, because once we have that knowledge, you never know who else you can reach, on a different platform globally. So just know that don't be intimidated because you may not have, a medical degree. That does not matter. You know your body better than anyone else, and just be your own advocate. Um, and ask for those early mammograms. I am starting. You can reach me. I've just started. I'm in the beginning stages, but you can reach me on Instagram at the Tatas, the TATAS 365 on Instagram, and I've also just started a YouTube channel called the Tatas 365, and it's basically embracing breast cancer awareness 365 days a year. This is not just about October for me. This is not just about the pink month. This is 365 days a year that we have to stay woke about breast cancer. This is not just a month for us.
Yeah.
So that's where you can reach me, or you can reach me on my email, thetatas365@gmail.com. I'll be more than happy to answer any questions, and share my story, and hoping that I can reach someone else. I'm still going through chemo myself, so I have my good days, I have my bad days. Um, and I'm just trying to take one day at a time because I still have a long battle ahead of me. I still have surgery, I still have radiation, I still have to get through the year with chemo. So I'm a work in progress myself, but I feel like I have to do something because I feel like I can lose myself and not feel so vulnerable and weak and defeated on just focusing on what's going on with me by being a service to others. So I'm just trying to lose myself and what's going on with me by helping another woman. So that's where I am right now. I appreciate it so very much.
Thank you so much, ladies. I genuinely appreciate you taking the time to inform and enlighten our audience about prevention, about being your, self advocate, and knowing your risk, getting the help and the support that you need as well. Thank you, ladies. This was amazing. I'm hoping after we end the broadcast just a little bit more. So don't exit out of the our little chat room.
Okay.
And I'd love to hopefully maybe even have you back to um, if we get a lot of interest and questions coming in. I would love to have you ladies back to talk about this again at some other time. So again, thank you tonight to our audience who hung in there. We have talking about this very breast cancer, what we're going to closer talk on cancer tonight regarding women in the African American community. Thank you all and have a wonderful night.
Thank you.
Thank you.
Thank you. Bye.